Hi everyone, today we have Dr. Sir Faraz with us and he'll be sharing some key concepts about autism. Thank you so much for joining this topic. So let's begin. Basically, what is autism or autism spectrum disorder?
Autism spectrum disorder is actually is a disorder, neurodevelopmental disorders, in which the most affected is your communicative behaviors, your communication, your social interaction, your speech, and these are the mainly things that affects the child. And so it's a spectrum where you can have a disease, very mild that usually get overlooked over the time, and you have a disease that incapacitates your child. So it's a disorder that can have that can manifest with varying severity, varying from the speech, but it never affects the speech only. It's mainly affects your social, interactive, communicative behaviors. So it's mostly the social and communicative behaviors that is affected over here, and these are the things that are picked over the time that tells the child is suffering from this disorder.
What are some early signs that parents should look for if they think their child is autistic?
Yeah. The earliest sign that a parent should get high alert when the child doesn't respond to the name, to his or her name. Usually, a child responds to his or her name by the age of 9 months or 9 months to 12 months of age, and your child is not responding to his or her name. That tells you that he may not be suffering from this disorder. Other thing is that is either he is communicating with you with his proper eye contact or not, or he is not making a proper eye contact with you. If he is not making proper eye contact with you, that is another red flag signs. And then is your how is his social behavior? Either he interact or he is not interested in the surroundings. He remains busy with his own stereotype plays or in jobs. That tells you these are the child who needs some evaluation over the time.
Not all the children will be showing the same signs. Like there will be different signs. They have different developmental.
Very correct in saying so that all children don't have the same signs and same severity. So signs do vary over the time, do vary from child to child. So, but the main thing that is their speech that usually get delay over the time, their social interaction that is not appropriate with the age, actually. But they do grow developmentally when they have their motor milestones. They are attaining their motor milestones within the time, but their social and communicative, that is behavior, that is the most affected in the. But they do vary from child to child.
And what would you suggest that parents should do if they suspect that their child might be autistic?
Then the parents should always seek the help of their pediatrician, and especially if you have some suspicion, always ask at the age of 18 months or 24 months that they should apply the tools which are for the screening of this autism. So 18 months and 24 months of age, that is the recommended age for the evaluation of a child who is suspected to be having. And if he doesn't qualify at that moment, then he should be kept on the follow-up of even after some time at the age of 3 years and beyond, when another follow-up should be given and other evaluation should be done over the time. Because we know if you intervene very early, then the outcomes will be very much favoring. But if you get delayed, then the things get worse over the time. So it's better to have evaluation at early age and to intervene at very early age, so that you can have the better results and better outcomes. And it has proven over the time the children who were managed over very early, they got very well over the time, and then they they came in the mainstream of the children as well in the institutions and other things like that.
one message that you would like to share with autism parents?
Seek the advice and help, and it should be he should be or she should be managed the proper people who are well versed with this disorder, and who are competent people, and who are running a competent institution for it. Don't get spoiled in the people who have made it a business. So always go to the people who know this disorder, and who have a good team who can manage, who can take proper pain in the management of your child, and never get afraid and never get ashamed of it. It is a remedial disorder which can be corrected and which can be made better over the time. So never fear that you have a child with this disorder. It's not a stigma. It's a behavior disorder which can be corrected, which can be remediated over the time. So always seek a proper institution and proper person for the treatment of, for the management of your child. So never get spoiled with these business minded people.
Thank you so much for valuable insights, doctor. And if you're an autism parent, always remember, you don't have to do it alone. Ask for help when needed. Every step forward is progress. Progress will look different with every child, but it's always worth celebrating.